While it's become somewhat of a joke on the internet that searching for the symptoms of anything will lead you to believe you have cancer, that's just because cancer can affect you in so many different ways. It can often be difficult to differentiate simple aches and pains from actual warning signs that you need to see a doctor, which is why we scoured the internet for 11 early symptoms of cancer you simply can't ignore. Because if you want to avoid tough treatments like chemotherapy, the best way to do it is to stay vigilant. Number 1. Unexplained weight loss. Coming up first on our list is probably the most important sign from your body that means it's time to go see a doctor. Losing a few pounds, or even as much as 10 pounds, can be explained, say the experts at Johns Hopkins Medicine. But if you're having a hard time pinning down the weight change, like changing your diet or exercise habits, then you should probably wait to get a checkup before celebrating your weight loss. Number 2. Changes in bathroom habits. This one is especially true if you have a pretty standard daily bathroom schedule. But if you find yourself going way more or way less to the restroom, then you might be experiencing the early signs of cancer. The University of California's San Francisco, or UCSF, warns that significant shifts to your bathroom schedule could point to signs of cancer of the colon, prostate, or bladder, amongst others, and to look out in particular for consistent cases of diarrhea or constipation, as well as blood in your pee or poop. Many cancers, such as prostate cancer, are very treatable, especially if you catch them early on. That makes keeping track of how often you go to the bathroom on a given day a very important piece of the puzzle when it comes to knowing how to prevent cancer, the experts concluded. Number 3. Fatigue that doesn't go away with rest. Now, before you freak out, this doesn't apply to people that are consistently tired after working a full day, or who feel a little gassed on their first day off in a while, as fatigue affects everyone. Rather, this refers to people that feel like they aren't emotionally or physically tired, but still feel sluggish and lethargic all the same. The American Cancer Society, or ACS, warns that fatigue can be one of the clearest signs that cancer is starting to affect your body, and should be treated seriously if you find you fit this description. If rest, eating right, and staying active aren't helping you improve your physical energy levels at all, then that could be an early symptom of cancer. Number 4. Issues with your dental health. Another symptom of cancer that usually presents itself pretty early on is dental issues. Some of these include tooth pains, more bleeding when you floss or eat, and a sense of numbness inside or around your mouth. The experts at the ACS warn that these symptoms could present themselves to people with cancer caused by smoking, a common one being thyroid cancer, and another warning sign being sores that don't heal, such as if you bite the inside of your cheek and it still hasn't returned to normal after a few days. Sores that don't heal anywhere on your body are big warning signs that your body's immune system could be struggling to respond and may be hampered by cancer, but this is especially true inside the mouth. Number 5. Very heavy night sweats. If you are someone who gets a little warm at night and sweats, this probably doesn't apply to you. But if you are someone who literally soaks the bed with sweat by the time the sun comes up, then this could be a strong indicator to get to the hospital. This is because your body's response to infection is to sweat it out. And that is one of the ways your body also tries to push the cancer cells out, although it will obviously be unsuccessful. Before running to the nearest doctor, however, make sure that your body isn't simply experiencing a side effect caused by a new medication, as this can be quite common too. Number 6. Bloating. One of the more common warning signs of cervical cancer, bloating can definitely be a side effect of your body's battle against cancer. This symptom is tricky, however, since almost everyone experiences bloating, and it can be caused by so many different things, like eating. And so the Cleveland Clinic Cancer Center came up with some handy advice. Track whenever you're bloated if you want, sure, but only start to worry that it could be a symptom of cancer if it lasts more than 2 weeks. This could be a symptom of cancer, and in women, has a strong correlation with ovarian cancer in particular. Number 7. New lumps or swelling in your lymph nodes. Lumps are often the major sign of breast cancer, which affects a lot of women every year, making it probably the most well-known symptom of cancer. Growths or lumps on your body will definitely get the attention of even the most oblivious person. But many people fail to account for swelling in the lymph nodes that could very well be another red flag that cancer is present in your body. The National Cancer Institute, or NCI, has a lot of articles on the specifics of lymph nodes and their exact purpose. But the short version is that they are small bean-shaped structures that are part of your immune system and help the body fight infection and disease. If they become swollen, it's usually a sign that there is infection or bacteria inside of you. But it can also mean, especially if they remain swollen for a while, that your body is trying to fight off cancer. You can check if your lymph nodes are swollen by feeling for lumps under your skin located in the neck, near your armpits, or your groin. Lumps on or around your groin can be a warning sign that you could have testicular cancer. Number 8. Constant coughing. With COVID still an issue rightly on everyone's minds, a lot of folks are missing out on an obvious early symptom of cancer, that being a persistent cough or hoarseness that just doesn't seem to go away. This is another symptom that, while not exclusive to tobacco enthusiasts, seems to be most commonly associated with smokers, and a reason that the NCI warns that smokers should get their mouth and throat checked out more regularly than non-smokers. If you find yourself coughing a lot, it may be just as smart to take a visit to the hospital and not just get checked for COVID. Number 9. Loss of appetite and a hard time swallowing. Moving on to another early warning sign that may imply that you have cancer is a loss of appetite, especially if it is being caused by stomach pain or nausea. The UCSF warns that these side effects are most commonly caused by cancers of the liver, pancreas, or any other part of the digestive system. On the other hand, if you are having a hard time eating because you are having a hard time swallowing, and this lasts for more than 2 weeks, the UCSF's studies show that you may have some version of stomach, throat, or lung cancer, and should schedule an appointment immediately. The same goes if all of a sudden you get the feeling like food is getting stuck in your throat when you try to swallow, as this could imply a lump somewhere between your mouth and stomach. Number 10. A change in a mole or wart. As you know, cancer can strike almost anywhere on the skin, which is why cancerous moles or warts can lay dormant for years and then start to do damage and grow for a while before you even start to notice. Some great warning signs coming from studies at Kaiser Permanente say to keep an eye on any growth you notice pop up on your body, especially those that get a lot of contact with the sun. This could be anything from a flaky dry patch to a pimple, but the important thing is to monitor them for growth, bleeding, or if they become an open sore that doesn't seem completely normal to you. Other more complicated warning signs also include looking for growths that have one side with a different color than the other, and for blurred or sort of strange-looking borders of the growth, which can both also be signs that the growth could be cancerous. Number 11. Any sort of unusual bleeding. If you are leaking blood from your body, that could be a sign that your body is responding to your cancer like an infection and trying to purge the cells out of it. If you are suddenly bleeding more or just finding yourself getting cut more often, take note of it and bring that information to a specialist. The same goes if you get cut and bleeding much more and for longer than you are used to. Generally speaking, keep track of how well your body is responding to cuts and bruising on the skin, since cancer usually has a strong impact on it. Here are 2 more videos you might find interesting. Feel free to choose the one you like. If you enjoyed this video, give it a like and share the video with your friends. And for more interesting videos on health, subscribe to the channel.